Hello everyone. So after a long break, this is a case of topical phaco in a dense central cortical cataract. So the patient was little uncooperative, but it took time to take him in calm. So after giving the side ports and it was taking a bit time, but so the side ports was given. So following side ports, the rexis was done with hydrodissection and the rotation of the nucleus with entry of the wound. There was one the anti-rexis part was there, so it was removed with McPherson. Now prior to insertion of the phaco probe, I was checking the probe with the sleeve. So I wanted to make it little. I wanted to increase the gap between the rubber sleeve and the probe. So because it was a dense cataract, and I would not find problem in the making the trench. So I thought so far fair enough, but as you can see, my incision was little posterior. It was touching the limbus, so I was not well aware to it that what problem I will face in this surgery in coming step. So as you can see that when I was doing the trenching, the fluid was coming out from the rubber sleeve, and it was because there was one puncture in the rubber sleeve, because of that the fluid was coming out, and that was making the AC very shallow. So immediately my assistant noticed it, and after filling the AC with antechamber with visco, my assistant changed the rubber sleeve and he inserted a new one. So again I inserted the phaco probe, and prior to that I again checked it, how's the distance. So I thought it's a fair enough, well enough distance. And now I again started making the trench where my power was as usual, it was 50, and the vacuum was also the it was around 60. So I was making the trench, and yeah, it was the crack was occurred. So by I was so as I wanted to emulsify the one nucleus, I noticed I was pressing the lower lip too much. Because of that the fluid was coming out, and the AC was become shallow. So I again removed my probe, again filled the uh, AC the chamber with visco, and then again I started my phaco with the probe, and then I came to notice that it was taking a lot of energy, because now I was using the chop mode where my power was 40 and the vacuum was around 310. So one part was emulsified, and for taking the second part, uh, the nucleus was getting cracked, but it was very fragile at periphery. And so when I was emulsifying the second heminucleus, the uh, two of the parts were they came behind the probe. So with the help of my dialer, I was pushing it in the forward and in close of the probe, and then I was emulsifying it. And now it was the last part, so I was doing in the epinuclear mode where my power was very less. And so after doing the full phaco emulsification, I came with irrigation aspiration. So as I was doing the IA by sweeping method, I was not noticing that the conjunctiva was getting swollen up in the wound side, in the main incision side, because as my incision was little posterior, the fluid was repeatedly, which was coming out of of the eye, which was it was going inside the conjunctiva or inside the subtenon. So I was concentrating myself on doing irrigation aspiration. I was concentrating myself on doing polishing and polishing behind the rex margin. So with so on and so forth, the fluid was again getting accumulated in the subconjunctiva and the subtenon margin, and slowly the conjunctiva was was swelling on, was getting swollen. So I was not noticing it, but at the end part of the polishing, then I noticed that there is some issues is there. The conjunctiva was swollen up, so I uh, was feeling a little difficult the in irrigation aspiration, but uh, somehow I cleared and removed the cortex. But there's some cortex was there subincisionally, which was getting little difficult for me to visible. So I use the repositor, and I was retracting the iris, but was not getting possible for me. So I took the dialer. Uh, but also I took the Crooklyn hook, and I was rotating the iris posteriorly, and then I aspirated the remaining cortex which was present, and after that aspiration, I was again doing final uh, polishing, and as I removed my probe, I saw the iris was again came out, and and at the end of the polishing, the conjunctiva, at least almost half of more than half of the quadrant of the conjunctiva was swollen up. So I was getting little difficult on judging that the how much amount of visco is there. But I thought, should I puncture the conjunctiva, or should I puncture the tenons to aspirate out the to remove out the fluid? But I thought it is well enough, so I can insert the lens. So by wound resistant technique, I was inserting the hydrophilic monofocal lens, and yeah, initial the leading haptic went to the back, but when I so noticed the trailing haptic was in the sulcus, so I again used the irrigation aspiration probe to insert it in the back, and so it was finally get inserted, because initially I was having problem judging it whether the trailing haptic was inside the bag or not, but it came inside the bag. But then I was having little problem during irrigation aspiration, but it was finally done. Now I was noticing that the entire conjunctiva, almost more than half of the conjunctiva got swollen, and I was getting little difficult on doing irrigation aspiration. But somehow and somehow I managed it out, because the patient was also getting little uncooperative, and since I was touching the iris more, so the patient was having little pain in iris. So as you can see, the iris was coming out from the main wound. So then I saw that everything was cleared. So I first tried to form the main wound, and once the main wound was formed, then I decided to go forming the side ports. And yeah, it was getting very difficult on forming the side port, but uh, it was uh, somehow the side port hydration was done, and the AC was formed. And luckily, when I closed the eye, it was after a few hours it came back to normal. Thank you.